Hi, hello, Patrícia. I think we are live. Yes.
Yes, I am. Hello.
Yes, welcome to the session. This session is talking about plain language summaries. So I will, and we would like to thank our sponsors, the Pan American Health Organization, Evidence-Based Medicine Center in Lanzhou University, China, and Canada's Drug and Health Technology Agency, CADTH, as well as our panel sponsors. And with that, I will pass it over to our panel.
Thank you, Vivian. Welcome, everyone. I can see you now, but I'll see you in a minute. And I was told to wait a little bit so that everyone can join us, because you're coming from other plenaries and sessions or from your breaks. So I will give you a few minutes to get here before I share my screen. And today we are going to tell you a story of a project we conducted, Rafael, I, and a lot of other colleagues. And we'll answer your questions later, okay? Or during the presentation, please feel free to interrupt me and to ask anything. Okay? I can see how many we have with us. Can you see something?
Yes. I think we have 11 people here.
Yeah.
So Vivian suggests we wait a minute or so for people to join. Yes, I can see there are people joining. So perhaps we can wait a little bit more.
That's all right. It's totally all right. Welcome, everyone. I'm very glad to be here today to tell you the story of this project, because it was something very difficult to do, and we are very happy that we finished it and ready to begin again. So what I will do while we wait, I will share my screen so that we can at least show what this is about, right? So now I cannot see you anymore, but if you need to ask something, interrupt me, I can hear you, okay?
Just to say, we see two slides right now instead of your.
So maybe if I do this.
Yes, much better.
Good. Ready to begin?
Yes, I think we can, Patrícia. Please, everyone, feel free to send your questions. I will be passing on to Patrícia.
Yes.
And thank you, Patrícia.
So as I said, what I'm going to present to you today is, in reality, it is a story, the story of this project that we conducted together with the Brazilian Ministry of Health, together with PAHO and Unifesp, which is the university where we worked, okay? So it was about developing plain language summaries for research that was done, commissioned by the Ministry of Health. So what's the story of this initiative? So the Brazilian Ministry of Health has a department that's called DECIT, Department of Science and Technology. And they commission research out there to provide evidence that they use in the Brazilian national health system that is called SUS, Sistema Único de Saúde, SUS. It is equivalent to the NHS in Great Britain, only with much less resources, right? But it's the public health system that the population can use for free. And this department needs evidence to guide their policies and decisions. So they usually commission all types of research, including systematic reviews. And they realized that sometimes it would be better to have knowledge translation about the results of these reviews, because the people using the evidence don't have the time or resources to read sometimes 100 pages of a systematic review. So we did reviews on demand for them through an agreement letter between the ministry, PAHO, and Unifesp, the university. They hired us as a team of experts in health technology assessment and in communication. So in the team, we had both myself working with communication and the other researchers. So this was a team able to provide rapid responses. We developed over 1 year, so 12 months, 10 projects. This is very quick. So we had sometimes 2 months, maybe less, to develop the evidence, to find the evidence, and to communicate it. And the fact that we could communicate the result of the research before the article, the traditional article publication, made it possible for them to use, to take decisions, to change policy, whatever they wanted, right? So the objectives of the project overall were to promote the use of scientific evidence in decision-making at SUS by means of the development of rapid response products, okay? This was for COVID pandemic, but also other topics that they needed, as you will see in a minute. The scope of the project involved some types of projects. So reference inventories. So all that the ministry needed sometimes was that we searched and found the references available on a specific topic. Sometimes, most times, I would say, those inventories inspired evidence synthesis, meaning that we started doing the review, as the name says. We also developed some courses for them, for the technicians inside the Ministry of Health, so that they could use and understand everything, how this type of research is done. Every time we finished one review, we would give them a seminar about the results of that specific review. And everything we produced was coupled with a plain language summary. The courses that we provided them were about the methods of systematic review evaluation as a whole, types of bias and how to assess them, identify them, assess the risk, how to synthesize the evidence, the numbers, meta-analysis, things like that, and obviously grade to evaluate the certainty of evidence. The seminars, as I said, were about the results, but also a final seminar presenting what I am presenting to you today. What were the challenges and proposals for communication in health for them to plan the future? Because they want to keep doing that, right? And what should we change to make it better? For those who don't have an idea about the size of Brazil, Brazil is a continental country, as you probably heard of. 215 million people of population spread all over. And that means that the Ministry of Health has to make decisions based on regions, on state, on different localities, because first of all, the incidence of disease changes. So, for example, we have while we have a higher incidence of esophagus cancer in the south, we don't have a lot of malaria there. Malaria is in the north and northeast. And the way people refer and know about diseases is different too. So the names of diseases change according to the region you're working. This is the first challenge we had. So we have regional demands that are different, and the Ministry of Health, the National Ministry of Health, receives requests, demands from all over. They have to prioritize one or another and find solutions for that. As I said, we developed lots of searches and reference inventories about these topics you're seeing on the screen, like tuberculosis, bullying, pregnancy, contraceptives, some types of medication, antibiotic therapy, etc. Some of them, as you can see, turn out to be rapid reviews too. In the end, we did a complete systematic review on the use of masks to prevent COVID-19 for people who are vaccinated or had the disease already. This one was particularly challenging, as you can imagine, and I'll tell you about more about that later. And if you want to talk with Rafael about this, you have a lot to tell you. So how did we organize our work during this year? First, the Ministry of Health would give us the research question. So this box here. Give us? No, they would not give us. They would say, oh, we want a review about blah, blah, blah. And we had to turn that into a research question, formatted according to the PICO acronym that you know: patient, intervention, control, and outcome. Once we had the question defined and agreed with them, this is when where we started looking at the methods we would use to formulate the solution to give them. Then, once we had the protocol approved, this is when we started developing the review. This is where I came and started looking at what was being done, and I followed all the process so that I was able to write a good plain language summary later. I participated in the whole process. Sometimes I even helped with the review, sifting or reviewing, synthesizing the text, etc. And this was valuable because this means that I didn't have to contact the team again and again to ask questions, because I already knew. I was participating in the reviews, right? And then it goes like any other review. Adjustments, final report. We gave them the seminars, as I said, provided the final report to the ministry. They would suggest some adjustments sometimes. And then all the things started again, right? Regarding this part here, when the plain language summary, how did we develop the process of creating it? So the first thing, and I would say the most challenging issue with developing these plain language summaries was the definition of the targeted audience. Who are we talking to? That was a problem because in the start of the project, the idea was that we were going to write the traditional plain language summary aimed to the citizen, to the person with a low health literacy, with a low educational level, that is the average in Brazil. The person who, for example, would access the Ministry of Health website to look for information, or those who visit health clinics, that was the person I was aiming to write to. The problem is the ministry needed something a little bit more complex to provide to policymakers and managers. So we had managers of hospitals, of regional hospitals, or of primary care units, and so on, that need to make decisions about what kind of treatment they will adopt in their health centers, etc. We needed to talk to them. So as you will see, most of our plain language summaries became what we started to, instead of PLS, as we usually say, we started calling them GLS, because in Portuguese, manager is gestor, a word that begins with a G. So we had PLSs and GLSs. And so the work started by me asking them, okay, what do you want? Is this for the manager or for the public? Once the target audience was defined, we started working with the group to see the review, the report, etc., and write a draft of the text. This draft had a minimum set of content items that we defined beforehand. The problem, the health condition, the situation that we are talking about, for example, tuberculosis, pregnancy, whatever, the solutions that the review is looking at. So, for example, can we give hemodialysis for pregnant women? And compare that to what? The effectiveness, the risks, the harms, the negative points, for example, costs. We made sure to point out to the uncertainties in the literature, because I think we should educate our readers to expect that. What do we don't know? What don't we know? What's the gap? The implementation of the intervention, the cost, most important, the date where those evidence are available and valid, and the sources. We wrote the text, we added graphical elements as needed, infographics, photos, illustrations, formatted it in a way that could be read, for example, in an A4 piece of paper or in your WhatsApp group, right? And made adjustments and delivered a final PDF. The basis to build that list that I told you about were several works out there. First, the Discern tool. The Discern tool is a questionnaire for you to evaluate the quality of texts about health provided to the public. You can use Discern to evaluate anything like a newspaper issue, a website, a leaflet you give to your patient, whatever. I used some principles of Code that is used for websites too. Literature wide, lots of things about PLS out there. Reporting guidelines, they are for article publication, but I used some principles to build this, and my own experience as a past journalist and a medical writer. First, I created a model, like a template, with those minimum contents in a format that was easy to use. But then another challenge that I faced here, the ministry said, you know what, don't use your format. We want you to use our visual identity. They had already pre-formatted designs of materials that they used to share with the managers, especially the managers. A color, logos, fonts. So I had reduced flexibility, but that's all right. We made it happen. So as I told you, the PLSs became GLSs in most of the situations, and that means that we were, in both cases, we were talking to the people who make decisions. But the PLS, the person who makes decision, is deciding about an individual, so they themselves or their family, someone they care for. Whereas for the GLS, the manager language summary, it was public. Sometimes it was regional, sometimes it was national. Sometimes it was a small health clinic, for example, surgery, but most times it was a cluster of hospitals, for example, right? More people. In the first case, patients, carriers, family, community. They have low educational level, low literacy, and low health literacy. This is what we expect from the public in Brazil. On the other hand, the managers, they can have high educational level. At least to be hired as in the Ministry of Health, you have to have at least high school and a technical level, but usually you have high education, like university, right? And because of their work, you can expect medium-high health literacy and numeracy. So it was a relief that I could speak about numbers without being so difficult for them, right, in the plain languages. So I know you are expecting to see examples, so here they are. This is the general layout that the ministry asked us to work with. So a huge title on the top, the colors always blue with the logo on the back, you see, and the sources below, etc. I had to adapt to this format, right? With a question and with a small summary. One example is this one. We evaluated the efficacy and safety of antibiotic therapy given intravenously at home. Is it possible to take antibiotic therapy to the home of the patient instead of giving it in the hospital? So this is a typical question that is very important for the Ministry of Health, because if we say you can, that means that they can release a lot of beds, of hospital beds, because they send patients to home. Okay. We worked with 3 pages in this case, with infographics in the end, showing the quantities of people in each study, where the studies were from, and what they compared. And I think it was much easier for the manager to understand that no, they can't send people home with antibiotic therapy. Another one was this. This was challenging. It was a typical Campbell collaboration review, because it was about the effects of interventions trying to deal with bullying in children and adolescents. It was a giant review, a huge review. Rafael can talk to you about that lots of studies sifted and evaluated. But the problem was they were all different between them. You cannot compare one with the other. So it was very difficult to show such a heterogeneity in the plain language summaries. What I did was to tell them these studies evaluated a list of different interventions, and I put all those there so that they could see that they were sometimes comparing apples with oranges. They could not be compared at all. Very difficult to synthesize this. And the next example I'm going to show you was very nice to work with. So we had to review the use of masks in those situations I told you, for people who are already vaccinated or had COVID, so they would have some immunity. Should they use masks? Is it safe? Is it effective? Do they protect? And as you can imagine, it was last year, so lots of studies being done, but the quality of the studies was not good. And it was very difficult to say it is safe, it is effective or not. So in the end, I had to write a plain language summaries saying, I don't know. It is one of those situations that we have to communicate uncertainty. We don't know. And I had to do that in such a way that anyone would be interested and engage with the reading. The text was long. I could not shrink it too much, but I needed to find a solution to make people read it. And in this case, I'm talking about the public. Well, there is a phenomenon in Brazil. Everyone uses WhatsApp. Everyone has a cell phone and they use WhatsApp all the time. So everyone is familiar with this type of layout that you're seeing on your screen. So I obviously, for copyright reasons or for even the layout used, I could not use the green and gray color of WhatsApp, but people can easily identify that when you're chatting at WhatsApp, your question, what you're saying goes on the left and the person's on the right, or vice versa. This is a dialogue. This is a conversation. So I started by asking, by showing like a conversation between two people, where the first asks, those who had COVID or were vaccinated, do they need to use masks? That's it. Simple question, like if the person was asking the ministry. And the Ministry of Health responds, that's a good question. The Ministry of Health asked for this response using a systematic review. Obviously, people don't know what a systematic review is. People with low educational level, right? So the person in my dialogue asks again, really? But how does this systematic review works? So they are showing that they don't know. They are showing that they need to know first what a systematic review is before we start speaking about masks, right? And the ministry says, it is a study about other studies. In a systematic review, the researchers look for and review all the evidence available, all the research that was made about a topic in health. They do it systematically. And the person asks, but systematically, what is that? What does that mean? what does it mean, systematic? And the ministry answers, systematic means that they have to describe the method they used to search, and they need to search everywhere, not only, for example, not only researchers in Brazil, but internationally. And they are not allowed to leave any study behind or outside. They have to include everything. That's it. We explained for them what a systematic review is. And the person asks, do you mean that they cannot choose the studies that they are going to analyze? And the ministry said, exactly, they cannot choose. So the conversation goes, I won't read everything for you, but this is the way I found to first explain what a systematic review is, how it works, and what did they found. In the end, they say, well, we looked and looked and looked, and we couldn't decide if it's effective or not. And the person asks, okay, but what do we do now? And the ministry says, well, let's play the safe hand. Use it, but we can say that you will be protected for sure. More or less, it was like this. The final page obviously gives the technical stuff about the review, the number, so that people who with a little bit more of literacy can search if they want.
Yeah, Patrícia, perhaps we can just, I think this was a right timing question, because I'll try to send to you. I'm not sure you're going to read it, but Al asked, how did you adapt the PLS for sharing on WhatsApp? I think that you already mentioned that the PLS was adapted in the WhatsApp format, right? That was
yes.
The key.
So what I did there, you can see, I'll share again. It is an A4 page of paper. But what the ministry can do is to reduce the size so that this becomes an image, a GIF, a JPEG, so that they can upload to WhatsApp if they are using that. In this case, they were going to publish this in their website, not in WhatsApp per se. In this case, what I did was to simulate the use of WhatsApp so that people would be engaged to start reading. The other plain language summaries, they could transform the infographics and the text into images to upload to WhatsApp. Is that all right?
Yeah. Al continues asking about what kind of feedback from the public did you get about the effectiveness of the WhatsApp format of the PLS? And if do you think this was an effective method of getting the message across the public?
So we don't have this feedback just yet, because this was one of the late made in the end. But we know that the Ministry of Health technicians would publish that in the website in the end of the project. We don't have this feedback just yet. What I can give you as a personal feedback is that whenever I use WhatsApp for the public in Brazil to show evidence about anything, I usually use simple language with an image, and that gets very well understood. So we are waiting for the specific feedback about this piece here. We don't have it, but we expect it will be good. The problem is this evidence is already old, right? So I'm not sure that they will invest a lot in spreading it a lot, because we probably have more evidence now published in 2022.
Yeah.
So what they can do, what the Ministry of Health can do, is to use this format that we developed to create new products, right? Do you agree, Rafael?
Yeah, of course. This was a very early pandemic review that we did, and the whole evidence ecosystem was being established. In that, everyone remembers that, and it was a very early a review that we did, and the results are obviously not up to date. I'm
Yeah.
not sure if the Ministry of Health continue up to date this review, but I think that Patrícia said very well. The format and the lessons learned about this communication, it was used the format of PLS. We did not have any ways within our project to have a direct measurement of acknowledgement of any kind of qualitative or quantitative assessment of the public feedback. We don't have this kind of possibility because we talked only to the technicians in the Ministry of Health, and they had the this choice. They had all the power in the governance to decide if they are going to use the products, how would they going to divulgate the products, or they are going to share the products. And sometimes they used only internally with the Ministry of Health high level management, as we call here in Brazil, right? So
And another thing that I would say, Rafael, is that
yeah,
we are in process of renovating this letter of agreement with them. And in the proposal, I asked exactly for that. We need feedback about the use of the products we developed, because without that, you cannot see the lessons learned and so on. I think that we should include, for example, focus groups or meetings with patients in different regions, so that we could test the water a little bit more. From the technicians, they love it. We had extremely positive feedback from this. It seems that the managers started to understand things, and they had less burden in reading the whole systematic review. Instead of reading those large documents, they could read our synthesis, right? So
yes.
here are the positive points that I was going to start telling you. So I think that this project was very nice, because it was the first time the Ministry of Health in Brazil took a step to communicate health evidence to managers and the public. Usually, this type of communication would stay inside, would stay in the government level. They make decisions, and they impose the decisions to the public. Here, they were telling the public, we are doing research for a long time. We are commissioning research for a long time. We are going to give you the answers, the results of this research. This was the first time. It may be shocking for you, but this is how the ministry in Brazil worked before. So this was the first time there was a communicator in the research team too. I'm not just a communicator, I'm a researcher too, which makes it easier for me to understand what everyone is doing. But I have a strong background as a journalist, as a communicator, as an editor, and as a medical writer, so I could help a lot the team. And another thing that was very, I would say it was crucial for the project to go on well, was that we had flexibility. As I said, we prepared 10 projects in 12 months. And it was always in the last minutes that they would tell us what they wanted. We didn't know what we were going to work with next. Sometimes we had an idea, but the final decision was always in the last minute. So we had to adapt our way of working and adapt the communication as well. As they told us, this project promotes the use of scientific evidence on public health decision-making, provided capacitation for decision-making and evidence interpretation. So managers told us that they felt more confident in evaluating the research results. And we could release and disseminate the communication products quickly, because they were produced quickly. Negative points, we always have those. They sometimes delayed in the definition of what they wanted us to do. This led us with a very short time to develop the review and the communication products. So it was difficult. We had a lot of administrative and bureaucratic barriers, delaying payments due to this relationship between the university, PAHO, and the Ministry of Health. You can imagine how many contracts and minutes and paper we had to sign. And we are talking about a large group of researchers. And something I told you, and I'll tell again, I think we should have PPI here. So patient and public involvement in the decisions from the beginning, from now on, if we carry this project on. So have citizens and lay people to work with us, to tell us if it's readable, understandable, if the format is nice, etc., etc. If they can tell us from the beginning, I'm sure we'll make a better product. We should have a way to set deadlines according to the complexity of the product they want. So you can do a search and a research reference inventory quite quickly. On the other hand, a complete systematic review with a great evaluation, etc., takes more time. It is more complex. Depending on the amount of evidence you find, the complexity is different too. So we should set the deadlines according to the reality we face and not pre-specified 2 months for everything, so that we can set the administrative flow beforehand, including the communication. Lessons learned. What did we learn with this? It is possible. It is feasible. We can do it. All commissioned research by organizations like a Ministry of Health or an agency should be communicated to the public, because the public funded the research by taxes, right? We should have PPI. We should include patients in the research and in the production of this communication, because we are doing with them, not just about them or for them, to them, but with them, right? It's a principle. It's always good to have a communicator in the team. I can't tell you of how many times I had to say, don't use that word. Don't pose this question, this sentence in the negative all the time. Things like that, that health researchers are not trained to do, right? And one thing that I would do is to have a liaison with the design team. So if they want us to use their design, their logo, their colors, their format, that's all right. But I should work with them to adapt things better. Because what happened here was that I was delivering PDFs already formatted. And if we had the designer with us, we could get a better result, right? So thank you very, very much, everyone. If you are still here, I hope you are. Let me stop screen sharing and see if you have more questions.
Yeah, I don't see any question here in the chat, Patrícia. But
Yeah,
perhaps,
I don't see it either, but I'm here.
but I have a question for you, and
Good.
this is actually a real question. Everybody, it's not. We did not. How to
Out of
say?
the pocket.
Yeah. We talk a lot about translating the results of research, but I think that a very difficult part was translating the methods of research, especially for high level management in the Ministry of Health, right? So, what was that experience for? Were you expecting this, or you said, no, we are going to translate the results for the public? What was your experience translating the methods, complex methods of review synthesis to high level management that they don't know? They don't know about this kind of studies and meta analysis. We did meta analysis. We did a lot of high statistical, complex statistical methods in some reviews. What was your experience about that, and what is the whole the what is the whole of knowledge translation in the methods, uh, in translating methods to management? Yes, did you understand right? What I said, yeah.
So I think this is where my experience with Cochrane helped, because we did research in Cochrane and in the department where we worked, and they were all systematic reviews. And I had an experience of 4 years doing translation of that to Portuguese. I know about systematic reviews. I know about systematic review methods. So that helped. But on the other hand, you could as well consider me an expert. So how can an expert speak plain language? That is difficult. That's not easy. And what I do when I need to communicate about systematic reviews to lay people is just that. I invite people to talk. I try to speak about a review with someone, for example, a taxi driver, or someone in the bus stop, or someone I have no familiarity with, and I need to make them understand. Invite someone to a coffee and try to explain to them and test the water. Do you understand if I speak like this? Oh, you didn't, so I have to find another way. And then I tried other solutions. For the managers, it was a little bit easier because they have literacy, right? They can read. So I could use more words to explain, which I cannot do with the lay people. How do you do it? You tell a story. Methods is what you have done in your research. How did you conduct your research? Oh, first I did this, then I did that. Try to tell a story. That's the solution I usually give to people trying to write, for example, abstracts or plain language summaries methods. Tell the story of what you did and why in simple words. It's a storytelling thing. And everyone has the talent and has in it. Everyone has listened to someone in the family telling stories. So we have this on us. Just try to tell the story. of what happened. Right?
Yeah, very nice, Patricia. It was a very interesting project, and I hope people enjoyed your presentation. I certainly did. I think was a great effort, and I learned a lot. And I think we could collaborate with evidence-based decision making in the Ministry of Health. In
But
the
now I have a question for you.
Oh, okay.
For you. So if you are here with us, Rafael has just defended his Viva PhD today. He's a
Yes.
doctor today. But Rafael graduated as a doctor and started doing research very early. How was this experience for you, Rafael, having someone, a communicator with the team, telling you what to say and what not to say? Was it difficult?
Yeah, definitely. I guess working this project, I came from in a pure research background. I was only a researcher. I only talked with other researchers, especially the researchers that are within my field of research. Right. So it
Lots of
was
jargon.
yeah yeah. So it was very interesting to see the other side. That, as I said, I mean, see the side of the management and see how they think. It changed my perspective about uh, urgency in getting the evidence right. We don't have this in academia. We do the things on our pace, right? We do the research, we do the methods. They needed for yesterday the evidence, especially the COVID related topics. They need for yesterday. So it was very difficult to, but in the same time, it was very, we learned a lot with this contact, right? And we definitely saw what are their challenges in their perspective. And I'm sure we learned a lot with that. And for sure, this increased the way I I see the importance of our work to talk directly for with those that talk to the public, right? So it was very interesting and well, and work with a science communication was great to learn from your side too. I don't think that someone without training should be doing this because there is a high level of knowledge and things that only you know, Patricia, that was needed for us to develop a good communication product, right?
Yeah, the background counts, right? We should train more journalists in research methods, research integrity, so that they can understand it better, right? That's the reality.
Yeah.
Right? So we still have, what, 6 minutes?
Yeah. I don't know if we can end a little bit early, Vivian. I'm not sure. Or
Yes,
if anybody
yes,
else,
no problem to end early. Yeah.
or if you, Vivian, have any question.
Well, now you're putting me on the spot. You know, I think this was fantastic. I love the story about communicating. I love the WhatsApp dialogue. Really, the Campbell collaboration is prioritizing, you know, how to make it easier to use our systematic reviews. So, and I'd love to see the example that you shared about the bullying and from our bullying review. And yeah, I don't have
that one was difficult. I can see how you suffer.
Yeah, and it really resonate to me that you need to use a communicator, you know, because you just have you know the science of communication, which is different than trying to use plain language, right? It's not just the reading level; it's how you communicate the message
on the whole.
Yeah,
right?
Yeah, just love it. So. Yeah.
That's good. That's good. Happy to hear that. All right. So should we say goodbye?
Yeah. Yeah,
All
thank you
right.
a lot, Vivian, the organizers.
Yes.
It was a very, very nice. Here in Brazil, it's late in the afternoon, so it was very, very nice to spend this hour with you.
Yeah, it's
Here
late
it-
afternoon. I think we're losing some people from the chat. So maybe I'll just put up the last slide to thank our sponsors and thank both of you. And
So
I
yeah.
hope we can collaborate in the future.
All right.
Okay.
Thank you. Bye bye.
Bye.
Thank you. Bye.